enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness.
I want to acknowledge the outstanding work that has been done by Stephen Shore and Dr. Brian Clement. And I feel very honored to be here with you today to not just to give you a simple message, but really a simplified, complex message. I am concerned more than anything else today about planetary survival. I'm not only concerned about human health, I'm not only concerned about ecological issues, I'm not only concerned about ethical issues, animal survival. I'm concerned today about, particularly, a holistic concept of planetary survival. When we look at the American scene, when we look at the Western society, when we look at the worldwide viewpoint of the diseases today that are hammering us, we have to begin to talk about the chronic diseases. Chronic diseases are diseases that are hanging around. Chronic diseases are diseases that we have no medical answer for in most cases, because most of these diseases are lifestyle related. Leading the pack, of course, is the cardiovascular disease epidemic. Every third death today is caused by cardiovascular disease. You have cancer and diabetes. They account for 7 out of 10 deaths in our society. And yet, it wasn't always that way. Here you see a book by Sir William Osler, 1928. He wrote, you can expect 1 heart attack a year in an average hospital in an average-sized town. Did you get that one? Now, things have changed. As you can see, today we have 4,000 heart attacks a day. Things have really changed quite a bit. Look at the cancer rates. Breast cancer, for instance, it used to be 1 in 20 women. Now it's 1 in 7 women developing breast cancer. Diabetes, you see a tsunami of diabetes rolling over our population. And a disease that we usually looked for when a person was 50, 60 years of age now is being found as a type 2 diabetic in the 15 and 16-year-old. These are not diseases of aging. These are diseases of something else. Just to give you some more information here, diabetes has been doubling every 15 years, and today a baby born can expect to be 1 out of 3 becoming a diabetic by the end of a lifetime. And if you are born to a Hispanic couple, then the odds are 1 out of 2. Something has been happening. And look at the American seats. They have not changed very much, have they? They didn't until about 30 years ago. And this is the American enlarging derriere. Something is happening. You have seen the statistics, haven't you? This is every 5 years, and you can see every 5 years the obesity rate in adults increases by 5% across these states that you see there. So you see the light blue, that's less than 10%. 5 years later, you see a new color, it's now less than 15%. Less than 20%, less than 25%, less than 30%, and today more than 30% of the dark red states in America today are having obesity prevalence rates of over 30. It's now 33%. And if you add overweight to it, you come up to a figure of almost 70% of the adult population in America has become overweight or obese. Something is happening. And with obesity, you have to worry about the different increases for different diseases. Here you see the chronic diseases. You increase the likelihood of diabetes by 7 times when you're obese, especially if you have over 40 for the BMI. You have blood pressure. Likelihood is much, much higher. Heart disease, arthritis, asthma, sleep apnea, and certain cancers in adults are all optimized, tragically accelerated by the presence of obesity and overweight. And again, I want to make this point that these are not diseases that are occurring in greater frequency today because we are becoming a more aged population. No. There's a net increase here that has to do that across the age span, these diseases are increasing. Here for the 45 to 64-year age bracket, Americans that are having at least 3 or more chronic diseases has increased by 50% in just the last 9 years in this survey here. And so we are committed as a medical profession to taking care of chronic disease, and we try to do everything we can with medical technology to find the cure, and the cure is very elusive. We're basically impotent as a medical system to take care of diseases that are largely lifestyle related. They relate to how we eat, how we drink, how we exercise, how we live our lives, or the optimism that we ought to have towards life. These are the kind of issues that are becoming driving forces, and there are not easily found medical high-tech answers. Let's take a look at some of these high-tech answers. For heart disease, we use bypass surgery. We do this year about 400,000 bypasses at a cost of about $150,000 each. And yet, the very best data that we have suggests that we probably don't extend the life after bypass surgery in more than 10% of the cases. And I suspect that these percent success rates that we have at best are probably related to the fact that the bypass and the pain associated with it scared the person so much that they stopped smoking, lost weight, and did something about it, and that might be the reason why we have at least some success. Just to give you some idea, when you have a vein graft, you have taken a vein from the leg, you transplant it to bypass the coronary artery. We have to recognize that 75% closure or narrowing is taking place again in these grafted vessels, 10% in the first week after a $150,000 surgery. Are you with me? Within 6 months, it's 18%, and within 12 to 18 months, about 40% of these grafted vessels are at least 75% narrowed again, because no one bothered to tell people, this is not the answer. This is a temporary answer. But you need to now begin to make some real lifestyle changes, some of the things that we talked about earlier. How we eat, how we live, how we carry on life, how we handle stress, how we exercise. And then, of course, you have angioplasties or stents. And there we do about 1 million here in the United States at about $35,000 each time. And again, there are some real problems with that. For one thing, I heard one person say to me, he said, a stent is like a Pringle. A stent is like a Pringle. I didn't understand. And so I had this wide-eyed look. And he said, don't you get it? You never just take one. Bingo. You never just take one stent. I've seen people that have had 25 stents, one after another. Because nobody told the people there's an underlying disease process you have to address. And so now the New England Journal of Medicine recently reported that the new guidelines from the American College of Cardiology recommend, they demand that these stents are contraindicated unless they're done within 24 hours after a heart attack. How about medications for bypass? How about medications for coronary disease? Here you have statin drugs to lower cholesterol numbers. And again, they can reduce overall the mortality by about 14%. This is in people who have had a heart attack. This is in people that have established heart disease. This is called secondary prevention. However, if you have not had any heart disease at all, the guidelines are very clear. The benefit of these statin drugs, even while they bring down the cholesterol, do not provide very much of a clinical benefit. For instance, you can lower the bad cholesterol, the LDL cholesterol, from 139 to 98 points. And you think, wow, that's really an improvement. That should really help the heart disease to begin to reverse the process. No, the evidence is lacking that these cholesterol-lowering drugs in primary care, in primary prevention, will reduce the likelihood of a heart attack to occur. It's really shocking news. I can go beyond this, and I can raise the question, are we just treating numbers? I mean, if I can bring the cholesterol down, the LDL from 139 down to the 98, as in this illustration here, am I not doing anything clinically important? And the question is, we don't know. If anything, it's very doubtful. We can go now and take an example here looking at hypertensive drugs. We're not treating the cure. We're not finding a cure for hypertension by taking these medications. As a matter of fact, there are always complications to worry about. There are always side effects. It's costly, and there's no effect on the increase in the incidence rates of heart attacks when you use these hypertensive medications, even if you bring them down. Same thing is true for what we call anti-glycemic agents, which is used for managing the symptoms of the indications of diabetes. Again, whenever you have a medication for diabetes, except for one, the insulin, everything included, they will always cause the diabetic to become more hungry. They're appetite enhancing. As the appetite goes up, you eat more, you gain more weight, your diabetes becomes worse, you have to take more insulin, you have to take more medication. That causes more of a hyperphagia syndrome, where you eat more, and the whole cycle starts over again, an insidious, vicious cycle. And yet the answers are actually quite simple, as I'll show you later on. Just to give you some idea, 51% of all insured Americans are now taking drugs regularly for chronic disease. 28% of the seniors take 5 and more drugs every day. And we have this idea that there's a pill for every ill. People tell me that. I just have to find the right doctor to diagnose my ill, to match it with a pill, and then send me home with a bill. And all in 7 minutes. That's all we have. The system imposes these kind of time limits on the medical profession.